A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. Cataracts, a clouding of the lens of the eye that affects vision. Symptoms include blurred vision, dull appearance of colors with a yellow or brownish tint. We often hear of cataracts when you see glare and starbursts while driving or walking at night. What's the most common cause? Is it aging? The most effective treatment is surgery to remove and replace the lens with an artificial one. More than 1 million cataract surgeries are performed annually, and more than half of Americans over the age of 80 are living with cataracts. Although surgery is readily available, according to the World Health Organization, cataracts are one of the leading causes of blindness, accounting for more than 51% throughout the world. Look at this statistic. In the United States alone, over 24.4 million people over the age of 40 are affected by cataracts. As we age and live longer, as many as 50 million Americans will develop cataracts by the year 2050. On this edition of your Hometown Health Connection, we will meet a top specialist with information on the latest technology that will have you seeing more clearly. I'm John DeSciullo. Welcome to the program. Dr. Ephraim Atwal specializes in laser vision correction, including LASIK and PRK, EVO ICL laser-assisted small incision cataract surgery with premium multifocal intraocular lenses and the light adjustable lens, which we're going to talk about in this show a lot. Dr. Atwal is the director of the Atwal Vision Correction Facility in Cheektowaga, receiving his doctorate from Jagiellonian University in Krakow, Poland, completing a fellowship with world-renowned researcher Dr. Herbert Kaufman at LSU, an internship in internal medicine at Ochsner Clinic in the Ochsner Clinic Foundation in New Orleans, with an ophthalmology residency at the Ochsner Louisiana State University School of Medicine in New Orleans. How about that for a resume? Dr. Atwal is also the medical director of eye and tissue services of Connect Life. So Dr. Atwal, welcome back to the Hometown Health Connection.
Well, thank you for having me again. I appreciate it. It's nice being here.
So we talked a little bit about the adjustable light lens that we're going to talk about, light adjustable lens.
Yeah.
We're going to kind of learn about that as we go through the program because it's so important to learn how that will impact people with cataracts.
Sure.
But let's start with the basic. What is a cataract?
Sure. Yeah. It's a common question we get, and a lot of people often confuse cataracts and LASIK, and are the two interchangeable? Frankly, a cataract is just the lens that's in your eye, which sits behind the colored part of your eye, the iris. That lens, which is nice and clear that you're born with, turns dark or muddy or opacified as time goes on. And when it gets to a certain point where you can no longer correct your vision with glasses or contacts, that's usually a good indication that it's time to look into cataract surgery. And so that's when people come to us and have their surgery.
And when they come to you, you've always offered sort of the latest in technology, and you've been revolutionary in that, you and your father, for a number of years.
Yeah.
So, and that's what I think makes your practice so unique. And we're going to talk about that very particular lens
Sure.
in just a little bit. But with respect to cataracts, and for our audience that's watching that may be of an age where it might start to happen to them, what is, or is there an age where a cataract becomes more prevalent, or is it something that any age group could suffer from?
Well, the reality is any age group can suffer from it. I think that in our country, we'll say this, that as time goes on, you're more likely to get a cataract. But I've operated on just about every age a human being could live at.
So with that, does it happen in one eye, both eyes? Is it common to?
Yeah, I mean, I think for the most part, generally speaking, it's going to happen in both eyes. But there are times where we have very severe cataracts in one eye and nothing on the other eye. Trauma can make that usually the case, but typically you're going to get them in both eyes, even if it's one's more significantly affecting the vision right now. It's just a matter of time before it's going to happen to the other eye.
So one eye could start and the other eye would follow?
Absolutely.
Or one could be different than
Could
the
be
next.
either way.
What affects the vision? I hear sometimes this light, the people that drive at night, they start to see streaking. What does the person see?
Yeah,
that gives
so
them an
in terms of
indication?
cataracts, what's going to affect how you're going to perceive it is typically you're going to see nighttime driving tends to be the first thing that people notice. The halos, the headlights are too bright, and they tend to look down at the lines on the side of the road, for instance. You might notice that there's streaking coming from the street lights. Difficulty driving at night, and a lot of times what an indication for patients to come into our clinic is I no longer drive at night. And anytime your vision is compromised sufficiently where you feel you need to stop doing that, it's usually a good time to consider cataract surgery, because we want people living their lives to the fullest. And if you're compromised so much that you can't drive at night, time to come in.
And so if somebody's out there and they're saying, you know, I'm starting to maybe experience some of those symptoms,
sure,
they should not be afraid. We were talking earlier about people that are afraid to seek medical attention for some reason. They should not be afraid to come in and meet with you to find out what is going on. What do you talk to a patient about when they come in for a consultation?
Well, I'd like to address that one point. I tell patients, and I think it's important for your viewers to understand, everyone's afraid of having their eyes operated on, and no one wants to have any surgery, period. That being said, you want to have your cataracts addressed on the earlier side as opposed to the later side. A lot of patients are so terrified they come in when it's really quite difficult to remove the cataract safely. And so we urge our patients to come in on the earlier side so that it's safer for the eye and they can experience the good vision for longer in their lives.
And when you work with the patient after you determine that they have a cataract, surgery, I would think, is probably the best way. Is it the only way to handle a cataract?
It's the only effective way I've seen it. You see a lot of websites that'll indicate that there's something else, but no, surgery is the only thing that I've ever seen effective for it.
And the surgery that you perform, what is involved in that procedure? Because I understand it happens right in your facility.
Sure.
And what is involved in that process?
Yeah, so we have a surgery center, Buffalo Ambulatory Surgery Center, that's attached to Atwal Eye Care. And we're very fortunate to have that proximity, which allows a lot of convenience for our patients. But typically, when I talk to patients about what a cataract is, I make the analogy of a M&M. And so the simplest way of explaining this surgery to patients is make a little hole in the candy shell of the M&M, remove the chocolate from the inside of it, and then put the new lens inside of that remaining shell. That's essentially it. And it's that M&M that sits behind that colored part of the eye.
And when we hear of the surgery for cataract, we also see the follow-up sometimes with the glasses. And
yeah.
How long does the surgery take, and how long does the healing process take?
Well, depending on the surgeon that you go to, it can take anywhere from 5 to 30, 45 minutes. It really depends. I've been very fortunate to be effective at my job, and I think anywhere around 5 minutes is probably a good time for us to do the surgery. The glasses that you're referring to, they are safety glasses. They're polycarbonate, and they're designed to essentially protect the eye from any flying objects in the air. They also provide some good wind coverage and UV coverage as well. But they are not essential to wear all the time, only when it's when you're outdoors immediately after your surgery, for instance. We don't use big patches over the eyes anymore. You can just use we use a clear shield after the surgery, so you can still see through the eye after your surgery, go home, and only really wear that shield while you're sleeping for the first week. So, you should be experiencing very normal life very quickly after your surgery.
Everybody has a different moment in their life when they're up close and they're on a computer, or they're driving, or they're construction work and they're outside,
sure,
or whatever their lifestyle might be. How does the cataract respond, and how does your surgery respond to the lifestyle of the individual? And we'll talk more about that in a little bit too, but everybody's a little bit different. Some people need to see, or they have vision where they can't see up close, up
sure,
far. How does that play into this?
Well, I think everybody's different. And like I said earlier, I think that once your vision is compromised sufficiently for you to be ineffective at the things you love doing, whether that be work or your hobbies or enjoying your time with your family, it's usually a good indication to come in. So there's so many variables that are involved there. I think it's best to just say, if you're suffering at any capacity, give us a call.
And you'll do a lifestyle evaluation on people.
Absolutely.
What does that involve?
Well, I think it's a very important part of our diagnostic process, and it essentially determines the things that you enjoy to do the most. For instance, I love to read. I have several hobbies that require pretty crisp vision. And so for me, I value my near vision. I value my intermediate vision because I tend to research a lot of things on my computer. And I value my distance vision, but that's not true for everybody. Some people never read a thing unless it's a label on a box, for instance. Perhaps they just enjoy sitting and watching TV all day. So a lot of times we'll ask our patients to make the decisions that are involved for cataract surgery based on their lifestyle, and they can't make a wrong decision then. If I start putting my personal preferences onto other people, it doesn't really make sense for everybody. I value my reading visions, other people really don't, and
right,
they don't mind their glasses. Some patients love the way their face looks in glasses and have a penchant for glasses, and so that's what's best for them. And so we'll help the patients decide what is the best solution for them given their lifestyle.
So that lifestyle, whether they like to read close up, they use a computer, they're outside a lot, they, like you said, they wear glasses, they don't.
Sure.
But let's talk a little bit about how diabetes might affect
Sure.
the person and the lifestyle, because we've heard that people who are diabetic can have difficulty with their vision, or it impacts their vision.
Yeah.
And maybe some of our viewers out there are battling with that. How does that impact cataract surgery?
So I think how it most appropriately impacts it is in the prognosis. What I mean by that is, what can we expect after the surgery? We want to make sure that our patients understand what's to be expected from their cataract surgery. I can't make everybody 20/20 because of limitations that might exist in the eye. Diabetic retinopathy, if it's significant enough, can certainly be one of those issues. Other issues like that would be macular degeneration. Some patients have what's more commonly being referred to as an epiretinal membrane. And so there's several things that we need to determine beforehand, but diabetes, for instance, it can affect the cataract itself. Diabetics get something like a diabetic cataract. It's a specific way it looks, for instance. It can affect the retina so that, there might be some limitation in the vision afterwards. So we always tell our patients, walking, using your medications, appropriate diet is important for not only heart health and for your body in general, but especially for your eye care.
And the cataract surgery places a lens right on the eye. We're going to talk about that very important light adjustable lens in just a little bit.
Yeah.
So there's a difference now between the lenses.
Yeah, so we have basically two classes of lenses now. We have fixed lenses, and when I say lenses, is when we take out the cataract, we have to replace that with a lens. Some of our patients say, do we have to put a lens at all? Can we just leave it the way it is? Physiologically, you have to put a lens inside of the eye. You really don't want to live without one, and it's not healthy for the eye. So we have to put a lens in the eye, but traditionally we've only had the options of these fixed intraocular lenses to replace the cataract. Now we have adjustable lenses, which is a brand new class of lenses that's available to us now. And they really broaden our ability to offer better vision for our patients. Statistics are showing that you're twice as likely to get to 20/20 vision with an adjustable lens, because we can really customize that lens for your eye once it's been implanted without having to perform another surgery that could compromise the eye in other ways.
So there's the fixed lens and there's the light adjustable lens.
Correct.
And those are the things that you will offer.
Oh yeah,
at Atwal
yeah.
Eye
There's
Care.
so many options. Oftentimes we have a lot of educational events at Atwal Eye Care, and it can get frustrating for us because there's so many options that we're presenting to patients, and oftentimes we'll present all of the options that are available for these patients. The problem is that most patients that come in, they're really only going to be selecting between 2 or 3 of the options when we're talking about what seems like 24 options sometimes. So it can get overwhelming and the patients get inundated with information. So that's why an examination is really best to have before you start investigating your options. The reason being is because you really don't know what you're going to qualify for based on the specific health of your eye. And after discussing with our counselors or myself, what kind of things would best suit your lifestyle and your personality.
Right, and with all of the years' experience that you have had in treating people and their eyes, I can see why that makes sense. You want to get that examination, you want to figure out what needs to happen, and then have that consultation with the patient as to where they want to go with it.
Yep.
And we're going to find out more about the light adjustable lens, and we're going to find out more about how this is all going to help you. We're going to take a quick break, find out about a lunch and learn where you can get more information with Dr. Atwal, one of the most comprehensive and empathetic eye doctors I've ever met. So we're going to take a quick break, and we'll be back with more on your Hometown Health Connection. If you want to connect with Dr. Ephraim Atwal, you can reach him at the Atwal Eye Care and Surgery Center location. They're at 3095 Harlem Road in Cheektowaga. The phone number is 716-896-8831. Again, get a pen and paper, write this down, 716-896-8831, and online at atwaleye.com. Other Atwal Eye Care locations are in Tonawanda, Orchard Park, East Amherst, and Snyder. Welcome back to your Hometown Health Connection. I'm John DeShula. We're continuing our conversation with Dr. Ephraim Atwal, talking about cataracts and the latest technology to treat them. So now, Doc, it's time to talk about the light adjustable lens. And we talked about the fact that you have a traditional lens, the fixed lens, and the light adjustable lens.
Sure, yeah. There's 3 main classes, I would say, or maybe even 4, but There's the fixed lenses and the adjustable lenses. The fixed lenses are the ones that we've done basically up to this point throughout the world, which are your traditional lens, which offers single vision. There's toric lenses, which offer the single vision plus astigmatism control. And then there's multifocal lenses, which offer multiple distance of visions involved. So one eye would be able to see distance and intermediate, or distance and near vision, for instance. And now there's the adjustable lenses. And the adjustable lenses, like the light adjustable lens, like you had mentioned, offers us the ability to control exactly where that vision ends up, with also some what's called extended depth of focus. And all these are very confusing terms, and that, and so we'll keep it, on the surface a little bit here, but essentially depth of focus is the ability to see from here to here without just being able to see here. So we want to be able to provide the ability to read your phone here and here, as opposed to one single vision, which is what the fixed lenses do. So the adjustability of an extended depth lens, like the light adjustable lens, allows us to really kind of blend all these visions together.
And when you say adjustable, it's placed on the eye.
Correct.
Or both eyes.
Yep. Yep.
And then you kind of wait and see how it works?
Yeah, so what we'll do is we'll place the lenses on the inside of both eyes during the cataract surgery. They're usually separated about a week apart. And during that time, the patient will wear some UV protective glasses, okay? At about the 2 to 3 week mark, we will then assess the vision. We'll assess the prescription that is in the eye, and then talk to the patient and see how do they like their vision. What do you think about your distance vision? What do you think about your reading vision? What do you think about your computer vision? And we'll have a discussion with them and determine what kind of vision the patient wants. At that point, we will sit the patient in front of a simple light machine that delivers ultraviolet light to the lenses. And that ultraviolet light adjusts the power of the lenses without having to do another procedure. And it's done in the clinic without having to go to the operating room or anything, more complicated than just sitting in a chair and looking into the machine. After a week of that vision, how did you like it? The interesting thing about the light adjustable lens is the patient gets to drive the vision. So it's no longer that we have to tell the patients what to expect with the vision. The patients tell us now what they like and what they don't like. And then we adjust the lenses according to their preference.
Does the light adjust the lens, or do you adjust the lens?
The light, well, we tell the machine essentially where we want the prescription in order to adjust it, and then the laser machine does all the work.
And so the lens must be made of a material that can be manipulated.
Yeah, it's kind of like a jelly bean, where it's a silicone lens, and the inside of that lens has some molecules that are able to move around throughout that lens. And when exposing certain areas of the lens to this specific ultraviolet light wavelength, we're able to move those particles within the lens to those areas and thus change the prescription. When all is said and done, and we've figured out exactly what we want and what the patient's needs are and how they like their vision, and once they say, "This is perfect, doc, I'm good," we lock the vision in at that point, and then we don't need the glasses anymore.
So we talked a little bit before we recorded the show. It's almost as if you use the analogy of me getting into your car,
Yeah.
And adjusting the mirrors and
Yeah,
the
yeah.
seat, or adjusting a car seat,
Sure.
For a baby. So you're adjusting incrementally a little bit, see how it goes.
Yeah.
A little bit. So
yeah, you might find that like you said, you get into my car seat and you have to adjust the seat and the backrest and how far you are from the pedals and the mirrors. But then you get 2 miles down the road and say, you know what, I need a little bit more lumbar support, or I need a little bit my back up more. So there's still the ability to adjust further at that point. We also use the analogy frequently of getting your wedding dress tailored. You get your dress off the rack and it fits really, really nicely, but in order to make it fit for the shoulders and for the waist and for the length, alterations are required. And so as time goes on, we find that the patient trials something out and says, you know what, I want a little bit more near vision, or I want a little bit more effective distance vision. We can kind of go back to that. So we have 3 or 4 adjustments available to us in order to tailor that vision to the patient.
Do people who have this light adjustable lens for their cataract, do you find that when they reach that point where they are 98% or 100% there. Do they need any other assistance like glasses or contact lenses, or does that?
No, the goal is
To make it 100%.
The goal is to make it 100%. And it's kind of like with a fixed lens when you get for cataract surgery, imagine your glasses are your first adjustment. Okay, so instead of having to get a pair of glasses, we can adjust it and build the glasses into your eyes. And so a lot of patients will get their glasses and they'll tell their optician, I don't like these either. Okay, well, let's adjust it again. With these lenses, we can keep adjusting it several times before we kind of figure it out. With glasses, it's not so easy. You know, you're not going to find too many happy opticians wanting to change the glasses around constantly either. But these lenses afford us the ability to do so.
So we come into your practice, we get a consultation, and I decide I have cataracts, I'm going to take this light adjustable lens. How long does that procedure take?
Well, the initial evaluation takes a little bit of time. It can be anywhere from an hour to 2 hours. And the reason is we get a lot of testing done at our facility. We get more testing done than probably any other facility in Western New York. And that's because what we've found over the years is we want to have a very clear idea of what the prognosis is for the patient, what the patient can expect after the surgery, what we should be doing or shouldn't be doing during the surgery that could impact the patient's vision long run. And so that's why we get a lot of testing. So 2 hours for the evaluation typically. When you come in for your surgery day, expect it to be there for about an hour and a half. About an hour before the surgery, roughly 45 minutes before the surgery. The surgery itself is probably the easiest thing we're going to do. There's an anesthesiologist in the room to make sure that everybody's very comfortable. The surgery takes about 5 minutes in my hands, and then
5 minutes?
Yeah, it's a very efficient surgery. And then typically you'll sit in the recovery room for about 20 minutes to a half an hour, ensure that you're feeling okay, and then you head home.
And I would think somebody needs to be there with the patient to help.
Yeah, and that's because the patients are receiving anesthesia.
Yeah.
Most of our patients are visually able to actually drive home, but because of anesthesia, it's not good to operate heavy machinery.
Yeah. If somebody has had cataract surgery already, maybe it's years ago, how long does a cataract surgery last for? Is it a lifetime correction, or does it need more correction down the line if it gets worse?
It's a great question. So, cataract surgery is it's a conclusively lifelong surgery. So you're not going to get another cataract back. There are some instances, in about 20 to 30% of our patients, you'll find that they develop a little membrane behind the lens. And some of your patients may have had an experience called a YAG laser or a YAG capsulotomy. Some people call that a secondary cataract, but it's not the cataract that's grown back. It's just a little membrane that forms behind the lens. And we laser that little membrane away very easily in the surgery center, and then once that's gone, nothing can come back. So your cataracts don't grow back, but that membrane can opacify the vision a little bit.
If I've had cataract surgery with a more traditional lens or multifocal lens, that's it. I can't now change it to the light adjustable lens.
No, there are some people investigating whether or not you could put in a lens, almost kind of like a piggyback lens, and trial to see if you can maybe adjust that without the need for glasses. But as far as your decision for the cataract surgery, you really want to be one and done. You want to make the right decision for you, and that's why so much of this discussion about lifestyle and the health issues that you might be dealing with your eye are so critical, because we don't want to have to manipulate the eye more than we need to.
Yeah.
Get the surgery done right the first time, and you should be all set.
What are patients telling you that have had this procedure done? Because it's been relatively new that's happening in your world. What do they say to you when they get this done and go through the tweaks along the way?
Well, I think the great thing about it is with the adjustable lenses, the silicone polymer lens that it's made out of offers such an incredible amount of contrast. And a lot of times when we're talking about cataract surgery, patients don't realize how much it's affected the contrast of things, which is simply my white shirt and my black jacket. The ability to discern the difference between those two things. A newspaper, for instance, has grayish paper and black lettering, but sometimes that becomes difficult to read because of poor contrast. And the cataract robs you of that contrast. The silicone light adjustable lens offers the best contrast available, but also it eliminates some of the concerns that people have had over the years with multifocal lenses, which include halos, blurred vision, some of the starburst that patients see. My father has multifocal lenses, my CEO has multifocal lenses, and they both love their multifocals. But they do say that occasionally they do see some of the rings. With this lens, you don't have any of that issue because it is a single focus lens, but with improved contrast. And so they're able to see their golf ball in the sand. They're able to, be able to read the paper or their Bible and be more effective throughout their daily lives.
Do you find that patients want to get the latest technology when it comes to whatever the procedure they need?
You know, it's interesting. Some patients want the newest thing available. Some patients want something that's tried and true. And I don't fault them either way. Frankly, I know that for me, being a technology geek, I want the latest and greatest, and that's part of our vetting process, is to ensure that these technologies have sufficient data and background available for us to properly vet them and to make sure that they have been used sufficiently. They have enough experience worldwide to ensure that our patients are getting the best products available. But everyone's different. You know, I try to let the patients, give them as much information as they can digest and let them make the appropriate decisions.
You mentioned your father earlier.
Yeah.
How long has he been in practice?
Oh, I don't know if he wants me to say that,
Okay.
but I'd guess just over 50 years. Yeah.
And talk about that relationship in the few minutes we have left, because I think that's a part of the reason somebody who's facing an eye issue, they want to go with a family that's been doing this for decades.
Yeah, our family's been involved for over half a century, almost a century of combined experience. And he came to this country from India around 20 years old, and essentially, his whole passion in life was ophthalmology. And I think that rubbed off on me. Clearly, it rubbed off on me.
Clearly, yeah.
So I loved what he was able to do for his patients. I would be at dinner with Dad, and patients would come up to him and just thank him for what he did. And I think that's true for a lot of physicians. Regardless of your specialty, the ability to help your brothers and sisters in the community. But I think, because of your vision, there was almost an emotional impact involved, a spiritual impact, if you will, and that had a great impact on me growing up.
I would think so, and he must be very proud of you, as are you
so.
of him. Yeah. So let's talk about the lunch and learn,
Yeah, sure.
because not only is it a lunch,
Yeah.
well, who doesn't like a lunch? What do you do with the lunch and learn, and how do you interact with the people that come through?
Sure, yeah, so lunch and learn is a lot like what we actually just talked about for the last couple minutes. We talk about cataracts, we talk about some of the options that are available, and then there's a Q&A afterwards where everyone gets to kind of express their concerns or questions or anything that they have with the surgery, which is super helpful for everybody else in the room, because there's some people that are more vocal than others, and a lot of people get to hear their questions asked by other people. And so it's a great discussion. That usually is the heaviest portion of the event, typically, because one question leads to another question, which leads to another question. And we're happy to do it. Debbie, my CEO, Deborah Davis, and I do it together. And we have a lot of fun doing it because we're learning every time we do these events as well about concerns of patients and how we can better serve the community.
Very informal way to go through a consultation without making it more formal. And then the patient can make the determination to follow up and do what they need to do.
Absolutely, and there's no obligation to have your surgery done at Atwal Eye Care or anything like that. It's really just a service we're providing to the community. If you want to have your surgery with us, it's great, but really it's an opportunity for people to learn about what's affecting their lives and then make the appropriate decisions from there.
Dr. Ephraim Atwal, thank you for joining us
Thanks
on your
for having me,
Hometown
John.
Health
Appreciate
Connection.
it.
We really appreciate you.
Thank you.
And learning all about important information about cataracts. We're going to have that information on the Lunch and Learn and where you can connect with Dr. Atwal. If you want to know more about the upcoming Lunch and Learn and visit with Dr. Atwal, it's Thursday, April 18th at Atwal Eye Care, 3176 Abbott Road in Orchard Park, or Wednesday, April 24th at Atwal Eye Care at 3095 Harlem Road in Cheektowaga. You can reserve your spot online at atwaleye.com or give them a call at 716-896-8831. Thanks for watching. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.